He was a 42-year-old architect, rushed to the emergency room. His heart was racing, his blood pressure was crashing, and his body was in a state of war against an invisible enemy. But the strange part? This entire catastrophic failure began just 5 days earlier with this, a tiny, insignificant cut. So how could a simple scratch lead to a fight for his very life? To understand, we need to go inside. This is sepsis.
Our story begins with a breach in the wall. The skin is our first line of defense. When it's broken, it's an open invitation, in this case, for a common bacteria called Staphylococcus aureus. At first, the body's local security forces, cells called neutrophils, handle the invasion perfectly. They are programmed to find and destroy these pathogens. This is inflammation. It's a localized, controlled burn. Redness, swelling, heat. It's the sign of a healthy immune system at work. But sometimes, the invaders are too numerous or too aggressive. They overwhelm the local defenses and spill into the bloodstream. This is where the script flips. The problem is no longer local, it's systemic. The immune system, realizing it's losing control, sounds a global alarm. It releases a flood of chemical messengers called cytokines into the entire body. This initiates a condition known as SIRS, or Systemic Inflammatory Response Syndrome. This is not the infection itself, it's the body's own overwhelming, panicked response to the infection. This is the cytokine storm, and it's here that the body's attempt to save itself becomes catastrophic. These cytokines tell blood vessels everywhere to dilate, to widen, in an attempt to rush more immune cells to the fight. This is called massive vasodilation. But when all your blood vessels dilate at once, the volume of your circulatory system expands dramatically. Your blood pressure plummets. This is septic shock. There is no longer enough pressure to push blood to your vital organs. Your brain, your kidneys, your liver are now starving for oxygen. This is the moment a patient's life hangs in the balance. The body, in its attempt to kill the invaders, is now inadvertently killing itself. The challenge for doctors is no longer just fighting the infection. It's fighting the body's own self-destructive response. The medical counterattack is a three-pronged strategy. First, powerful antibiotics to attack the source of the problem, the bacteria. Second, massive amounts of intravenous fluids to try and refill the tank and restore blood pressure. And third, if fluids aren't enough, drugs called vasopressors are used. They are a chemical signal that tells the blood vessels to constrict, to squeeze, artificially raising the blood pressure to force blood back into those starving organs. For M, the architect, the intervention was just in time. The storm subsided. His blood pressure stabilized. His organs began to recover. He survived, left with a profound new understanding of the delicate balance that governs our inner cosmos. If you want to continue exploring the engineering of you, subscribe to Inner Cosmos and let us know in the comments which hidden story of the human body we should investigate next.